ONH, Schizoid Personality Disorder. This is Owen. He is 8 years old and in the 3rd grade. This is Owen's family. He lives with his mom, dad, and sister. They live together on a quiet street in Park Slope, Brooklyn, in a brownstone. Owen's mother is a stay-at-home mom and his father works as a corporate lawyer. His sister Liz is 5. She is fun-loving and extremely social. Liz has lots of friends and is always smiling. Owen and Liz go to PS 146 in Brooklyn. Owen's mom is usually happy like Liz, but sometimes has downs and feels sad. During this time, Owen's dad won't let him and Liz see their mom. Owen's dad told them that their mom takes medicine for a mental disorder called schizophrenia. Although Owen's father often pressures him to join sports or take on a hobby, Owen always refuses. He has never tried any type of sport because he has no motivation or interest to do so. Owen's parents have been worried about him because he is a loner. He seems to have no interest in any kind of relationship with others, even with them. They have noticed that he seems to be completely preoccupied with daydreaming. And when he is forced to work with students in school, he focuses on the activity but does not socialize with his peers. Owen's favorite thing to do is get lost in his own inner world. Owen lives in a neighborhood with tons of other young families that have children his age. Everyone in his neighborhood socializes. They are always having block parties, play dates, and gatherings at the neighborhood playground. However, Owen has no friends. Although Owen's parents take him to the playground and try to encourage him to talk to the other kids, he prefers to sit on a bench by himself and daydream. The other children tell their parents that Owen is not nice and very peculiar. Recently, Owen's teacher, Miss Brown, has become increasingly worried about his social and emotional growth. In the beginning of the school year, she just assumed he was a quiet child and would come out of his shell sooner or later. Owen shows little to no emotion in the classroom aside from nervousness. Miss Brown has spent hours doing research on how to interest and motivate him, as well as build a strong classroom community in hopes that he would feel more comfortable and start socializing with his peers. Unfortunately, nothing has worked so far. Miss Brown has heard the other students talk about how dull and boring Owen is. Miss Brown has also noticed how unmotivated Owen is when it comes to almost everything. His constant daydreaming and lack of interest in school is affecting his grades and performance. Miss Brown has tried to pull Owen aside to offer extra help with schoolwork, talk to him about his feelings. She has even offered him cupcakes and candy in hopes of getting some type of reaction out of him. He has had no reaction and has shown no emotion in regards to anything Miss Brown has tried. When Miss Brown describes him to her colleagues, the best word she can think of is cold and indifferent. After conferencing with Owen's teacher, Owen's parents took him to see a psychiatrist. The psychiatrist asked questions like, have any close family members, including the mother or father, been cold and unaware of Owen? Was Owen thin-skinned and emotional as a child? And was this met with annoyance and/or anger? Was the child ignored or surrounded by unloving and neglectful environments? His parents answered no to all of the above, but when they told him that his mother had schizophrenia, the doctor diagnosed Owen with schizoid personality disorder. This psychiatrist was bright and asked all the right questions. Schizoid personality disorder is thought to be a result of a few different factors. One being in an unloving, unsupportive environment as a youngster, and 2, possibly genetic, stemming from a first-degree relative with schizophrenia. This doctor had experience with other adolescents and children with schizoid personality disorder. Owen is very lucky because many children are not diagnosed correctly or at all until they are adults. According to the Diagnostic and Statistical Manual 4, schizoid personality disorder is described as a pervasive pattern of detachment from social relationships and restrictive range of expression of emotions in interpersonal settings, beginning by early adulthood and present in a variety of contexts. Owen has illustrated these traits with his emotionally flat and distant personality and his complete lack of intimate relationships, even with his own family. Schizoid personality disorder is indicated by 4 or more of the following, according to the DSM. Neither desires nor enjoys relationships or human interaction, including being part of a family. Almost always chooses solitary activities. Has little, if any, interest in having sexual experiences with another person. Takes pleasure in a few, if any, activities. Lacks close friends or confidants other than first-degree relatives. Appears indifferent to praise or criticism by others, and shows emotional coldness and detachment or a flattened affect. According to the World Health Organization's ICD-10, they also add preoccupation with fantasy or introspection to the list of characteristics. This is a very important characteristic because it is present in almost everyone who suffers from schizoid personality disorder. Interventions and treatments for schizoid personality disorder. The nature of schizoid personality disorder itself becomes the main hindrance in its treatment. Needless to say, treatment of any physical or mental disorder requires a lot of interaction between the patient and the doctor. And that's why patients are often advised to open up about their medical history and other aspects of their lives, so the doctors can attempt to manage their problem. But this may not work with people who suffer from schizoid personality disorder. In this disorder, the patient tries to ensure that no contact is made with others, including doctors. This requires a medical expert who has a strong experience in dealing and treating this kind of disorder. These doctors are well versed with the techniques of reaching out to the patient without making the process apparent. Psychotherapy is the most important method that can help treat schizoid personality disorder. With time, the patient will be able to realize the importance of social cues and reacting normally in a social setting, and more importantly, about his or her moods, feelings, thoughts, and behavior. This in turn would help the patient to increase coping skills, improve social interaction, communicate most importantly, self-esteem. There are no medications that can treat schizoid personality disorder. Anxiety and depression often occur in people with schizoid, so anti-anxiety and anti-depression medicines can sometimes help. Self-help support may seem to be less effective than the above methods, but if the individual actually goes to meetings, it can help them to function in the face of unexpected changes. Here, the individual learns to mingle with people who are practicing new interpersonal skills, and in this way, he or she can overcome fears of closeness and feelings of being detached from the rest of the world. The important thing is for the individual not to feel pushed to express themselves. The importance of treatment of a person with schizoid personality disorder is important due to the complications that may occur if the condition is left untreated. Individuals suffering from schizoid personality disorder tend to develop drug and alcohol addiction, suffer major depression, anxiety disorder, extreme fear of social life, and other personality disorders. Although Owen is unable to show emotion about his diagnosis, there is hope for him. His parents have talked to him about the disorder and receiving therapy. Owen has agreed to start talking to someone. Owen is very lucky he has loving parents and a good doctor that diagnosed him early in his life. With ongoing intervention, Owen has the potential to learn how to form relationships and function normally in society.